Hello, my name is Dr. Reed Tuckson, and we'll be starting in just a few minutes. Our special guest is working through one little challenge and will be with us in just a moment. So we ask you to just stay tuned for a conversation that I think that you will enjoy. And in fact, I am now informed that our special guest is here. And so let us go ahead and formally begin. Good afternoon. My name is Dr. Reed Tuckson. And I have the honor of being the chair of the board of the directors of the Alliance for Health Policy. And it is my very great pleasure to welcome you to the final session of the Alliance for Health Policy's Health Equity Summit, a program of our 2021 signature series of programs. So far in our Health Equity Summit, you have learned that any approach to address disparities and achieve health equity must involve multiple, multi-sectoral strategies that work together simultaneously. You've learned that data is not just a large foreign set of numbers, but a reflection of what people, including you, are experiencing in their care. You've learned that leaving health inequities unaddressed for any population affects the cost of care and the health of our overall economy, that ultimately we really are all in this together. And you've learned that as a health policy community, we must change the narrative from they to we, that the voices we lift up in our work reflects whether we value all American lives or just some, and that if there are changes that need to be made, that we all have a role in implementing those solutions. And now we are fortunate to close out our meeting by hearing from the Centers for Medicare and Medicaid Services Administrator, Chiquita Brooks LaSure. She has really been an extraordinary person, and her experience has really reflected her vision for health equity as she completes her first 100 days in this vitally important role. Administrator Brooks LaSure is a former policy official who played a key role in guiding the Affordable Care Act through passage and implementation. As she drew upon her decades of experience in the federal government as Deputy Director for Policy at the Center for Consumer Information and Insurance Oversight within CMS, and earlier at the Department of Health and Human Services, where she was Director of Coverage Policy, also on Capitol Hill and in the private sector. Earlier in her career, Administrator Brooks LaSure assisted House leaders in passing several healthcare laws, including the Medicare Improvements for Patients and Providers Act of 2008 and the ACA, as part of the staff of the U.S. House of Representatives Ways and Means Committee. We are so pleased, Administrator Brooks LaSure, that you have been able to join us today. Welcome.
Thank you so much. I am thrilled to be here with you and thrilled that you are tackling this critical issue during this time.
Terrific. Well, listen, as the new CMS administrator, and my God, it's been 100 days in office. As you sort of reflect now on that vast experience, what is your vision for CMS going forward to advance health equity? How do you see it?
So this is a dream job. This is such an incredible organization. I'm thrilled to be here, and I've been thrilled at how much we've been able to accomplish in the first 100 days. One of the things that we've been focused on is starting every conversation with what is the impact on health equity. And it's been incredible to have that opportunity to really push the envelope as we examine every policy issue, every operational issue, and really consider whether it's, I like to say, the 3 M's, Medicare, Medicaid, and CHIP, or marketplace coverage. And we've been able to do that in some key ways. First of all, just the incredible amount of enrollment that we've seen across the country in terms of record enrollment in Medicaid and CHIP and the special enrollment period. And I think that healthcare is such a fundamental way to address health equity. I mean, it is not the only issue, but when you look at health disparities in our country, the differences between people who are insured and have coverage and people who are not, it's clear what a difference having insurance makes and having good coverages. And so that's been a real focus of this administration of putting more money into enrollment and outreach, and particularly for making sure that we're reaching hard to reach populations. So we just announced yesterday just how much we have seen in terms of record enrollment in the special enrollment periods, 2.5 million new people coming to the marketplace. But what we're also seeing is a shift in who's coming. And so we saw more diversity in terms of the number of the percentage of African Americans and Hispanic, Latino, Latinx populations. And this is something that we want to continue to build on. So that's just one, one of our key areas, but there have been many others of really focusing on maternal mortality. It's something very important to me personally, and of course across the department. And the the American Rescue Plan includes this incredible opportunity for states to expand postpartum care. So we are, I can't think of a bigger health equity issue than that one, although we continue to think about behavioral health and in so many other areas. We are focused on making sure, as you raised, we are collecting data, but data cannot be the end point. We're collecting data to make better policy, and that's what we continue to be focused on. The reason why we're getting data is to say, what kind of shifts do we need to make?
One of the things you just said right at the very beginning, which I just have to come back to, and that is the sense that you make equity a part of really your conversations right from the beginning, straightforward. You're a leader. And that's one of the things that there are a lot of people who are in leadership positions listening in on this session right now. How do you approach an organization that has to be so focused on the metrics, the numbers, the financial bottom line, folks who are bean counters in many ways? How do you talk about equity to people that may not have the same life experience that you do, the same lens of why it's important? What's the leadership lesson you're learning?
I would say it's a couple fold. And I think one of the things that I experience in my role on a number of topics is you can never talk about something too much. You have to, especially when you're running a huge organization, of saying the same thing over and over again, saying it to different audiences, helping people see it. I think that that's one thing, of being really consistent. So now when the teams come and brief me, I just got out of a briefing on a policy issue, and they said, that health equity issue is, and really came to me really weighing that issue. So I would say first by repetition of defining it, like what are we talking about, which I'll do in a second, how I define it for us. But also I think constantly giving people specific examples. And I think that we talk about health equity and we assume that everyone knows what we're talking about and that we have the same definition. And what all the research says is, people don't always, have the same meaning. And so really having a lens of looking at underserved populations, very explicitly focused on racial and ethnic diversity and issues for that population, rural areas, which I think, has not only is there just so much alignment of really understanding that, that different populations are facing different challenges, and of course, sexual orientation, disability, but really having the lens of, it's very easy when developing policy to think about the average, right? So you think about when you're trying to do policy, like on average, does this work for people? But the thing is about our programs is they affect real people every day. And we have to be very careful that as we're developing policy proposals that in aggregate make sense, that we don't end up advantaging the well-off and disadvantaging those less well off or the underserved, and then on average, everyone did a little better. And it really plays out in many ways if you don't ask yourself the question. And so again, just by starting to ask the questions, it may be at times that you make the trade-off, but if you don't ask, you miss the nuance.
Those are great lessons. Really, really important. Thank you for sharing that. As you move from your conceptual ideas to implementation, I'm curious about the tools that you have, the leverage points where you can influence that vision and make it come alive. You mentioned data as a tool. How do you sort of see these tools available to you, and how are you deploying them?
I would say that there are these tools vary a bit in the various programs, and so we are thinking about thinking them all in different ways. So let's take the Medicaid program, for example. So in Medicaid, our role is really more of a partnership with the states, who are the ones actually administering the program, and an oversight role. And so part of that is states come to us looking for flexibility to design their programs, which we certainly support. What we're bringing is making sure there's an equity lens to the waivers that states are coming to us in their proposals, that as they are designing their rules, and asking for exceptions, that we're really making sure that we're serving the populations. As we look at our managed care, which is growing across our programs, making sure that the managed care companies are serving dual eligibles who are particularly underserved populations in many instances, and making sure that people are getting value-based care, getting that in an equitable way, or even in let's make sure that we are lifting up the underserved. The Innovation Center we've learned a number of lessons in the 10 years, and the team in the Innovation Center has been really collecting the messages, those learnings. And as we move forward to the next 10 years, we are shifting to make sure that equity is at the center of the models that we're putting forward. So really measuring those things, making sure that underserved providers, that we are trying to engage them in a more profound way. And then, as you can see, this is something I'm super passionate about, so could talk to you for hours. But and then as we go through our Medicare rules, right? And so we are going through all the various policies, making sure that as we look at our data, our quality measures, that we are asking questions that are getting at health equity. So really testing those and making sure that the questions that we're asking hospitals, facilities are really meant to capture what's happening.
Let me ask you on this point. I'm very curious. And again, I know that it's early days, so you're not there's no announcements going to be made here today.
Yes.
But in terms of, as we think about, value-based reimbursement coming forward in these tools, do you see that as being something that we might actually measure and give people credit for dealing with equity, either at the practice level or system-wide level? Or do you see value-based reimbursement as being a tool to help equity, or will it hurt equity?
I think that value-based care and making sure that we are integrating care is really critical. I mean, we really, as a healthcare system, have to think about how do we manage care in a way that makes sense for people. And I think that that is one of the things that is really important to our vision, which is we need to move to those kinds of models, because we want to make sure that people have better health outcomes. That's the purpose, better quality. And then, yes, we intend to do that to save money to the system and be good stewards. But we don't want to save money and worsen quality. And we certainly don't want to move to value and only take care of the most well-off. reforms that really serve the population that is most in need of help. And that to me seems almost obvious, right?
Almost obvious. Well, it's certainly, I certainly hope, and as you explore these issues going forward, it might be. A lot of us are very interested in the idea of having an equity component to the measurement of how well systems are doing, or how well others that are in the reimbursement pipeline can do. And although the measurement has always been tough, and just trying to get these standards standardized, but that's important. Are you seeing difficult barriers that are confronting you? And if so, would you highlight a few of those for us?
I mean, I think, as we often say, if it were easy, anyone would do it. That's one of my favorite statements. So, of course, taking on CMS has an enormous responsibility, and there are often challenges. But I would say it's really out of so often challenges where some of the greatest opportunity lies. The Affordable Care Act, I've been thinking about it a lot as we are in some respects, a similar moment, not quite, but, I was on the Hill during the Affordable Care Act. And right before, what we were focused on was the Great Recession and really worried about the economy. And, those of us who are healthcare experts wanted to do healthcare reform. Part of the reason why that there was so much interest in the ACA was because people were going bankrupt because they had medical bills. And it was a serious issue at the time of the Affordable Care Act that people could not afford their healthcare costs. And so out of this difficult economic time grew one of the greatest expansions in coverage since Medicare and Medicaid were created. And so I see a similar moment right now where we are in the midst, hopefully coming out of a very difficult pandemic, which has highlighted incredible cracks in our healthcare system. It's an opportunity, and it's just one that I feel so privileged to be in this role, to have an ability to try to make it better. So that's how I think about it. And, like I said, if it were easy, anyone would do it.
Coming out of the COVID pandemic, as you are well aware, people of color have been so disproportionately affected. There will be a lot more people with illnesses, with pre-existing conditions. Long COVID will rear its ugly head. There are many folks who are advocates for minority communities who are concerned about the medical care and what's going to happen to these folks. And that will be a big burden, we would imagine, not only on the Medicaid system, but also Medicare, but private insurance. What are your thoughts there? And what do you say to the advocacy community that is concerned about what happens as we come, hopefully, at some point out of this pandemic crisis?
Well, I would say that how important it is to learn the lessons, right? Like, we are still in the midst of this, but we at CMS, and I think throughout the healthcare system, we need to learn the lessons of coverage is critical, right? So how could the federal government help people during the pandemic? A lot of it was through CMS because it's the coverage. So in terms of paying for testing and paying for vaccines, and now, moving into treatment, I think one of the key things is continuing to support getting people covered and making sure that coverage is comprehensive. So I would say that's one of the fundamentals. And then I think we have this window where there is interest in addressing our cracks in our system, and we have to keep working and elevating the lessons and not go back to the way it was before, and also, really focus on some of the things that are in more of a challenging place, like, say, staffing, where we had an issue before and now know that we are really facing some workforce burnout and staffing shortages. And so we need to address this. I think we, like I said, just really making sure we don't lose sight of that we need to continue to tackle these issues is just critically important.
Many of our workforce colleagues, and I'm so glad that you've elevated them in your thinking, who are just overwhelmed, as you say,
Mhm.
burned out and suffering. I'm a little bit concerned about what happens to the Medicaid providers, particularly physicians of color in inner cities, whose reimbursements are just so low. Is there anything other than the bully pulpit that you occupy that we can do to try to ramp up some of the Medicaid reimbursements?
So the safety net is such a critical part of our country, and particularly for addressing disparities. And certainly, this is an issue that states have more um, uh, responsibility in terms of setting reimbursement rates. Some of our levers are really making sure that people have access to providers, and it's something that we look at and want to make sure that we're working with states to really assure that providers are incentivized to participate, and part of that is certainly adequate reimbursement. And so it's a priority of our administration, certainly mine and the secretary, to make sure that we are focused on making sure that Medicaid remains an important part of our healthcare system, and that care is being had there.
One of the challenges that we have seen, so unfortunately highly illustrated through the COVID pandemic, has been distrust. So many people in communities of color, whether they're the Asian Pacific Islander brothers and sisters, are American Indian, Native American, Hispanic, Latinx, African American, are really revealing that they're making fundamental healthcare choices, in many cases not good choices, because of their distrust of government, distrust of systems and elites. It is not lost upon us that you are a woman of color leading this organization. How do you see your responsibility or role, or your opportunity to try to regain some of that trust that has been so eroded?
I take it very seriously, your question about what is my responsibility in this area. And so I am absolutely committed to, as part of the administration, something that I want to do anyway, is make sure that CMS is really reaching out to stakeholders and very responsive. But I personally get much more involved and want to be a resource in terms of different communities of connecting to me, because I am an African American woman, and really thinking, not only bringing that lens, but honestly, I was really overcome with just how much support I had across the country from people who really, it was meaningful to them that I am in this role. And I definitely consider it a responsibility of mine to represent and help educate when there is such a distrust on these incredibly critical issues of getting care.
Well, to end our conversation, one last question really quickly, and taking away from you personally, but you as the leader of the agency, what happens if you don't succeed?
Failure is not an option.
Well, I think with that, that is a wonder. No, I'm going to tell you what, that was so good. I'm going to give you the chance to leave us with the thought that you would like for this audience to leave. These are, and you know so many of the people that are on this Zoom and listening to this webinar, from the policy community that you are such an intimate part of. Going for, what is the one thing you want to tell us that we should be doing to be helpful to you?
Every single person on this Zoom has an incredible role, an incredible opportunity to advance health equity. And I would say that everyone in whatever their role is, should be taking that angle. And I think together we will be able to achieve this critical goal.
Outstanding. Well, that is just terrific. I really want to thank you, Administrator Chiquita Brooks LaSure, for joining us this afternoon and offering us such a wonderful glimpse into your plans. And I will say that for all of us, we will take your mandate to us to do what you said, but also I think we have to wrap our arms around not just you, but the agency. There's so much fractionization and polarization in our society today that we have to have winners, and we need to make sure the people that are in a position to win are put in a place to succeed. And so I will make a commitment on behalf of the Alliance for Health Policy for sure that we will be there to support you, and I'm sure everyone else would. Good luck to you and your agency. And we know you have to run back to a meeting. So as I wrap up, it's okay for you to drop off and run down the hallway.
Thank you so much
All
for
right.
having me.
Thank you so much. Well, that was terrific. And I think we can clearly see that we are in very good hands with Administrator Brooks LaSure. This concludes the Alliance for Health Policy's Health Equity Summit. It's a signal, an important program of our 2021 Signature Series. We really want to thank every member of our audience for joining us the past 2 days. Let me remind you that we want you to open the survey module on the left of your screen, and we do hope you will complete a brief evaluation of this event. I'm not going to be upset if you decide to just love us completely. That would be just wonderful. But honestly, your honest feedback helps us to plan future events. And we at the Alliance for Health Policy really do take the guidance and the constructive criticisms from our stakeholders very seriously. You will be able to access a recording of this webinar, and all the materials will be available for you to view at any time on the Eventia platform. So that's easy to access, the Eventia platform. And so all of us, thank you for joining us.